Hi.
Hi, Terry.
Hi, I'm good. How are you? Trying to adjust my mic. Uko aje?
I'm good. Good to see you.
Hey, finally we on the live. Hey,
Last week
last
was
week
just
crazy. Last week ilikuwa mbaya. But here we are. Nice to see you.
see you too. How are you?
I've been good. I know we are used to having joy all the time. Sasa leo wewe ndio uko. Tudil na wewe leo.
Yes, unfortunately.
It's not unfortunately, it's good because I know we'll get more information and something different, Mimi na Joy tumezoea hapa tu to story, but can you hear me?
Yes, I can very well. I was trying to, I think there's a place where you can put the title of the live somewhere. I don't know, it's
Okay.
just disappeared. Like a place where you could give it a title. Now it's gone. It's fine.
Okay, okay. But glad to see you're good. Glad to see you're okay. I think we'll just get straight into it because I know we've been having several conversations with Joy when it comes to we have dealt with grief. We have done, was it self-esteem and identity and self-love? I mean, we have touched on so many things with Joy. And when she mentioned we're going to do addiction, I said, okay, okay. And then she mentioned and said, MK is going to join the live. I said, we are good because I know you're very passionate about addiction. Sasa mimi nilikuacha ukiwa on a different field. How did we end up on this other side of talking about addiction and everything?
I think it was always the field I wanted to be in. I think I just left media to pursue it because it was the initial was it would we say the initial idea? At some point I felt like I wanted to use media to like portray or help people understand addictions more. So that's why I left. So at some point I was doing both, but eventually I had to cut back on one, which was media, but not to cut back in the sense that I don't use it. I think what has helped me grow now is the same thing I learned in media. So I just picked up everything I learned, put it on my back, and went with it. So I never left. I think I'm just on a different form of media. You
Yeah.
can just say traditional media.
Okay, yeah, because I think also where you are still creating awareness, which is what we do on this other end. So yeah,
Yeah.
I think it's true. You didn't leave it. You're just on a different path, but also still creating more awareness where you are. So what title do you go by? Is it counselor? Is it therapist?
I coach. That's basically help people in recovery. So
Okay.
there's a difference. A lot of people who are recovering from addictions need recovery coaching, while others need medication. Like a big percentage just need strategies on how to stay whatever they're trying to stay off. So there's two sides. There's somebody who needs rehab, and there's
Yeah.
somebody who needs to just figure out like how do I get stop using more than you. So
Yeah.
that's where maybe in the future I'll go into treatment, but that's not where I am.
Okay, all right, that's interesting. Naona some love coming in on the live. Please, if you are able to get us live and clear, please tuambie also. Join the live, share with friends, let them know that we are on today. We are talking about addiction. We are some few minutes late, but with the few minutes we have, we'll try and at least do a bit of an introduction, sindio? Because addiction is huge, it's wide. Hatuwezi maliza leo kila kitu. So it's like we are just laying the foundation today. And you can begin by just simply defining addiction because sometimes our definitions may vary here and there. But according to you, in simpler terms, what is addiction?
It's in the most simple way because there's different ways of describing it, but addiction is a chronic disease or condition,
Mhm.
just like any other disease, um, which is characterized by someone's inability to
Mhm.
not using what they're using or engaging in what they're engaging in. So the biggest characteristic is when someone is completely unable to stop themselves from using or engaging whatever they're engaging in. And because it's a chronic condition, a disease, there is physical effects or mental effects that are seen. So for, let's say, physical effects, somebody gets sick, the body starts responding because of excessive use of whatever they're using, or mental, when it's developing some disorder out of using something. So most people describe addiction as anything, like people have bad habits, not addictions. But addictions are chronic conditions. So there's a difference, just that the term is used so much for bad habits more than the condition that
The condition itself.
will diagnose you with. Yeah.
Okay, I think you've mentioned two things that I think I planned in my questions there. Number one, it's you've talked of chronic disease, and sometimes people disagree and say, "Oh, but is it a choice or is it a disease?" You know, some people will tend to argue that fact. I don't know if you can tell us, because sometimes someone, for example, if you have a betting addiction, we're going to talk about types of addiction. Utasikia mtu anasema, "Ai, but si ilikuwa by choice, si alifika hapo by choice." You know, so is it really a disease? Is it by choice?
The moment the choice leaves, it becomes disease. Where there are different levels, right?
Yeah.
Habit, a habit progresses into a disease.
Mm-hmm.
Now, the moment it stops being a choice, the
Yeah.
moment they no longer control themselves or stop themselves from gambling or drinking, then that is where now it becomes a disease. A disease is something that characterized by so much effects on you, and it is
Yeah.
not like you decide. The people who can't stop themselves from drinking, the people who can't stop themselves from smoking, that is a
Right.
disease. It started as a choice and ended up as a disease. So for
Disease.
most people think it's a choice because wewe ndio umeamua kufanya what you're doing, right? Like it's you who decided to do it. And the reality is, yes, at the beginning, but
Yeah.
those choices at some point, because of how our minds work, turn into a disease. So in the disease, there's no choice anymore. That's why there are people who we tell them, oh, see, just stop drinking, but they can't because it's not a choice anymore. It's a disease. So the moment a choice leaves and is out
Yeah.
of the picture, it's now a disease.
No, it's not disease. Okay, okay. Makes a lot of sense. I think I'll stop being judgy for a while there. Because sometimes you hear some addictions uko na si watch it too, especially the betting. And right now we have a lot going on. Using Konasoma newspaper, and there was a grandmother there, and I think I can't remember whether it was Daily Nation or Standard, but there's a grandmother somewhere who's actually addicted to betting, which brings me to the question on the types of addiction. Because sometimes when tunasikia addiction, we just think of drug addiction, but we can look at the various types of addictions that are there.
Addictions are characterized into two. There's either substance or behavioral. So substance is where the drugs and alcohol, everything that's substance, like something that you take into your body, that's one category. It doesn't matter. There's 50 million things you can take into your body. But then there is behavioral, which now the gambling things come in. A lot of things that are not taken in, but we feel in our bodies, in our behaviors, like gambling. Those are behavioral addictions. They
Okay.
don't leave in physical footstep. You can't. Somebody who's struggling with gambling doesn't have physical effects of it because it's behavioral. But you see the effects of their behavior and the finances and things like that. For substance, yeah, you get sick and all those things. So there's either substance or behavioral. And
Okay.
substance is things you take in, you eat, blah blah blah, and then behavioral is things you do. So addictions are categorized into just those two. Yeah.
Let's look at the signs first of all, and we can begin with behavioral before we can even go to substances as well. What does easy signs zinakaje, and does it vary in different people depending on age? And maybe we can also look at environment where someone is and stuff like that. Behavioral.
Generally, the signs are both behavioral and substance. There's no these are the signs for behavioral addiction. Is addiction. Zote is the same. They don't vary on environment or anything. Those things can matter later. They explain why someone is addicted. It's not like the environment explains that to us. But then the signs are all general. Addictions all work the same. They're all a disease of the mind. So they're all working the same. Most of the signs, the first one, as I mentioned, is the inability to stop when you want to stop. So either whether you're drinking or gambling, if you can't stop, like make the choice today, I have decided not to stop, but tomorrow, and you do it repeatedly over and over, and you say you promise you'll stop. That's one of the big signs that this is no longer your choice. Like your choice ended when you say, but then you haven't stopped. So that is the number one biggest sign that somebody's struggling with addiction. And then the other signs is how much they've progressed. So for example, for drinking, someone used to drink just one bottle. Now, they're drinking 5. So the progress upwards of drinking, if it's progressed that way, it shows clearly that you build tolerance. Tolerance is where you need more of the drink to feel the same effect. So kitambo, you would drink 1 bottle and you'd feel fine, like a 300 ml. Now you're taking 2 liters, you feel the same thing you used to feel. So that's a complete sign that there's something going on. That's now beyond. Then there's other signs that we see through families and friends. Now they're getting concerned. If family is saying, or friends or somebody next to you is saying, I think you might need to reduce, it's a big sign. It puts people in denial, but it's a big sign. Now, for substance, one of the biggest signs is the changes in your body. For example, if you're smoking a lot, now there's physical signs. You're getting sick. For drinking, you're getting sick out of drinking. Now you're having problems with your kidneys. If you're having problems with your judgment, with your eyesight, there's things that you can see. Another big sign is withdrawal symptoms. So if, mostly for substance, the moment you stop using, if you go 3-4 days and you start having headaches, or you start, your body you start sweating too much. It's like your body is demanding you to still use the same thing. That's a big sign.
Okay.
For behavioral, the withdrawal comes in forms of urges. So somebody was gambling a lot, and now when they stop, they're restless. Like they're just restless. 2 days of they can't stop. They just need the phone and something like that. So you're not using it to behave like somebody who's using it. That's another sign. Something is going on with what you're using or what you know. So there's like 11 questions people get asked as a criteria for a diagnosis, but those are just major results. And the most important one I use is you already know it. And people say, no, what do you mean? You already know there's a problem. Before you even reach out to somebody, you already know there's a problem.
You know.
Like, you already know it. You don't need me to tell you that you're drinking too much. At some point, somebody consciously thinks, you should know that thing of kujita kamkutano, when somebody says, okay. Yeah. The moment you have that meeting with yourself, then that's the beginning. You don't need a psychiatrist to tell you that what you're using is taking control. It's just the moment you call yourself for a meeting, that's the number one point where you need to call.
I mean, you've mentioned that last point, and it is true. Yani, by the time you're looking for someone, you actually know. It's like hizo maswali za, is it bad when? Is it okay when? Especially like when you've gone for events. And I mean, we're coming from April when ilikuwa na a lot of events and everything. And there are these people who always say, mi kunywa tu occasionally tu when the events and everything. But now you start realizing when events zimeisha and you're still on it, But anyway, you've talked of denying, and I know you think it's one of the stages of addiction, and maybe you can take us through some of it, because when, for example, una notice someone is addicted to a substance, or maybe it's behavioral, sometimes you tend to maybe point it out as another part, like if you're looking from outside, and unaambia mtu, I think I'm noticing of late umekuwa, but they'll be like, hapana, mi niko sawa, so there's that denial and everything. Maybe you can take us through the different stages that we have when it comes to addiction.
Denial is one of the stages where, and a lot of people fall into.
Yeah.
It's not nothing to be in denial. It's just one of the stages. And sometimes we crush people for being in denial. We make them feel bad for being in denial. In reality, there are many stages to change. There are like 6 stages to change. For you, denial is still like Uko Yuma 1, 2, 3, Somebody has to get to stage 6 of change where it's taking action, right? Like accepting it. I need help with my drinking, or I'm gambling too much. So denial is where, for example, practically someone who drinks a lot will say, I drink expensive alcohol. Like I don't drink those things you people drink. Like I drink expensive alcohol. Yeah, I don't drink alcohol. I drink in the best clubs in the world. So that they have a drinking problem, but they justify it because they believe that expensive alcohol doesn't make people addicted. But you clearly can see the problem here. Another big sign of denial is when people get angry or restless with some stuff. The moment you tell them, I think you're drinking too much, and they get defensive and they feel rattled about it, that's denial. They're denying what they're doing is crushing them. That's not a problem that people, it's something that people need to know. It's not a problem. It's just the stage that they'll get there where you want. You're stage 6, they're stage 2. So we have to learn to be graceful to people who are struggling with addiction, because we can't push them. I always say nobody can get sober unless they want to. So even in the denial part, they still haven't made the decision to get sober or to stop gambling or something like that. It's their own realization that will make them want to get sober. So you can beg them, you can point it out, oh, you have a problem, oh, blah, blah, blah. Until they wake up and have their own realization, then there's nothing you can do about it. So denial is not, it hurts families and people who are close to people who are struggling with addiction. But for them, for the addict themselves, and for us who understand it, say it's just a stage. Hopefully they get to the final stage where they can have their own realization. But yes, I understand the denial part is something that bothers a lot of you. If your partner is struggling with something, they're gambling too much, point it out, they get defensive. The sign, they're in denial. And one other sign of someone being in denial is when they over-explain what they're using. For people who are struggling with gambling, they'll try to explain it to you, like everything that they're doing. They'll over-explain and make you understand what they're trying to do, but you still don't believe it. No, it's a problem. Somebody who's struggling with alcohol and things like that will try to defend it and say, I just drank 1 bottle, and you clearly can see they're drunk. So it doesn't matter if it's 1 or 4, still you're drunk. So those are some of the signs of somebody's denying. And denial, as I say, is not a bad place to be. It's a stage.
Yeah. Okay. I think I said that about over-explaining, and I think I've been addicted to a particular food. And sometimes you keep, all the time you just have to over-explain and say, by the food, and for sure it's a problem that you have. It's a struggle. In fact, it comes to a point where it's a trigger. If you smell it or if you see someone just having it, it's something else. But yeah, I've been there before. I'm glad it didn't go to the extreme, but I think I was getting to that denial stage of, but si ninakula tu moja. But yeah, I think that's okay. Sawa. We're talking about addiction. So if you're getting us live right now, This is the conversation we're talking about, addiction. So yeah, uliza swali yako, because that is what we're doing. Today we're just laying the foundation because addiction is so huge. So we're just trying to understand, and then as we go on with time, maybe we'll try and narrow it down to now different things. Ndio, kama we can now do drug addiction peke yake, and then we're going to look at a lot of things. You've talked of something interesting, and I want to point it out about family. And let me just mention about how relationships are affected, especially when someone now begins to be addicted. You know, there's family, there's work, there's relationships around, you know, that are affected and all that. Let's talk about that and the effects of it.
It's not easy being a family member of somebody who's struggling. I think the hardest thing is watching somebody lose their potential. You know, like, you know, that cousin, that uncle, that brother that you've known for years, and watching them lose the potential in life because addiction is by far the worst thing. Because clearly you can tell this thing is going to ruin your life.
Right.
They can't do anything about it. You can't do anything about it. It's something that makes families struggle a lot because parents are seeing their children do things of drinking and changing, and you see the potential they have. You see how many years they're wasting. It's by far the worst kind of pain you can do. It's like you're losing them and they're still there. It's like you're literally in grief for the life that that they could have been. Like you always think of somebody's in their 40s and you think, they were in university 20 years ago, they were going to be teachers and things like that, and now back in the village. It's the worst thing ever. I always empathize with families, one of their loved ones who suicide addiction. It's not easy.
Yeah.
What happens is a lot of families don't know. So naturally, we get angry at trying. You know, like you could take somebody, as I said, you can beg somebody to stop it. So you take them to rehab, you take them to church so that they can be prayed for. Nothing is changing. You start a business for them, eat all the money. You take them to university, they never graduate. This feeling causes families to push themselves away. So you find the guy who's struggling with alcohol and abandoned class. And every family has that one person or two who nobody wants anything to do with them. You know, like yeah, nobody cares anymore. Like, you know, your drunk uncle. We always say like our drunk uncles in the families. People give up.
Yeah.
Now, other people who've never gone through that or never experienced that will say, don't give up on family, you know, blood is thicker than water and all those things. Yeah. And then you tell that to, you know, why would you abandon your brother and your sister kwa street squeezy? I've had so many cases of family members who just said, no, we can't deal with that guy anymore. And now people will say, blame the family for pushing them away. And I know there's families who deliberately do that, but most families, people just get tired. It's human state. We get tired of living with mtu anakuja saa 8 usiku, fighting everybody, anatukana watu. You can't have them on Christmas, akikuja, it's problem. So people genuinely try their best, but when it fails, they push the person away. So what happens in most families is people try genuinely, and when they realize that they've tried so much and it's taking their own mental health, because it's a mom who's living with an addict, it will take their own mental health. It could get you to the worst. What they genuinely push this person off, and everybody thinks it's the family's problem. But in reality, it's just that they couldn't take it anymore. So that's the main effect that it has on families. Now, when you let this person off the streets for drugs or whatever, it kills the family more because they're like, I wish we could have him in the house. But now he can't stay with us, you know. Like you meet them in the street, your so-called drunk uncle, like your shosh wants them to be part of the family, or your grandparents want them to be part of the family, but they can't sustain being part of the family. and the brothers don't want to do anything to do with them. But when they go to sleep at night, they always think about that one. They always pray for them and say, I hope he gets clean. I hope he gets sober and things like that. So it hurts both sides, where the person feels mmeniwacha because I'm an addict. Another family says, probably yes, but it hurts that we are doing that. It hurts that we have to push you away. So the effect is on both on the addict and also on the family.
Yeah, and I agree. I think I've dealt with someone who has been abandoned before, and the number one thing they always point out is family. Manze family yangu iliniacha. Manze walini abandon time nilikuwa na need. But also on the other side, if they are asked, they will still, echo the same sentiments that you're saying, that tumejaribu, we have tried almost everything with this person, but hakui sawa, But can we just talk about finances for a minute there? Because when either you're talking about behavioral or drug, or substance addiction, pesa iko involved. You'll either, if you are taking one beer, like you're saying, you'll end up taking 3 or 4. If you let's talk about finances. Naona kuna mtu anauliza, in such a scenario, what should you as a family do? Okay, I think maybe unaweza answer you before we can move on to finances.
Man, it goes in many ways. When you've tried everything to try to help this person, taking them to rehab 2-3 times, nothing is changing. It means that they've not reached the final stage of change, which is their own realization that they need to change. Most times when people decide to change, and it's not about addiction, it's about everything in life. The moment you decide, I want to change my life, I want to be a better person, that sticks. For an addict, they don't have the capacity. So that's why families sometimes force them into rehab and things like that. While in rehab, some of them realize, like you're confined for 60, 90 days, hapo katikati you realize, well, hapa nilichoma, so let me change my life.
Yeah.
Unfortunately, that's not the same for everybody. People leave rehab and drink the same day. It happens. It happens. And or they'll punish you for taking them to rehab. Like, you wasted my 90 days, so I'm going to drink myself out until you feel the pain. So what do? You've tried everything in your position to try to help them, then unfortunately there's almost nothing you can do at this point. It's only to hope that this person, gets to the place where they see that they need to change. Families, especially parents who live or brothers who live with people like addicts, we always tell them the person who needs to be told what to do is you. You need to now learn how to see their patterns. When they come home drunk, what do I do? How do I maintain my own mental health? Now you have to learn how to not get depressed by it, because there's nothing you can do on the other side. They will still get trapped. You can't control it, but you can control how you react to them. You can learn how to keep money away from them gently and softly, because you give them 100 bob, you're spoiling them. You give them 50 bob, they're going to do it again. So there are financial ways of managing an addict. There is mental health care that you can do for yourself. Asking in such a scenario, what should you do? Is take care of yourself more than, because the other person does not have the capacity to live around you. So rehab works. You can convince them if they decide, if not. If that hasn't worked, then it's time to take care of yourself more and learn how to. The programs where we help families know how to live with an addict because they have decided not to change. So until they do, which eventually might happen, like there are scenarios where change becomes inevitable. Like you could get into an accident when you're drunk and you realize there's no way I have to stop drinking. I'm not saying these bad things will happen to them or should happen to them, but you hope that something can wake them, right? But before that happens, there's almost nothing you can do apart from taking care of yourself. So that you don't go to mental hospital while they're in rehab at the same time.
Yeah, because I think kuna watu wengine pia wame end up in depression, in anxiety, in stress, because you're looking at a loved one, you can't do anything about it. you're really trying so hard to manage the situation, and probably, those loud uncles who used to come to a meeting and just when Joshua ameamka tu kuomba, then mnasikia your loud uncle drunk anakuja anagonga, like mnapatwa na stress, you feel like, but at that particular point there's nothing that we can do. But I love what you pointed out, that wacha nijiprotect kwanza, because at this particular time hakuna kitu kingine tunaweza fanya, to this person. Yeah, so Palma, thank you for that question. Thank you for that. And if you have more, please wekelea hapo while we are still here on the live, and MK is going to answer. I was speaking earlier about finances. Maybe you can tell us about that, because hapo kwa finances najua with every addiction hapo kwa mfuko inaumia pia, because you are at a loss all the time. It's deductions upon deductions.
Yeah, it's either behavioral or substance needs money to sustain it. Gambling, you need money to sustain a gambling.
Yeah.
So you need money to buy alcohol. You need money to do everything. Now, the financial impact is, let's say for behavioral, is, for example, like gambling, is people are always chasing losses. Chasing losses is basically like, you lose money. I lose 10,000 today. Tomorrow, instead of learning that I have, I've lost 10,000 today, right?
Yeah.
Most people, when they lose 10,000, they decide, I will never, ever gamble again.
That's true.
But for a gambling addict, when tomorrow comes and they have money, they say, let me gamble one last time, so I get that 10,000 back, then I can stop. So now they gamble again and lose another 20,000. On the third day, they now lost 30,000. So they say, with this 1,000, let me gamble, so I regain the 40 I've lost the last 2 days. And that is the cycle of gambling addiction. So most people in gambling aren't necessarily trying to get to sustain their lifestyle, to regain what they've already lost. You put 2,000 yesterday, 4,000 last week, so you look, 1 month I've lost 50,000. So when I get 50,000, I'm going to put it back again, so I can get 100 to regain what I lost yesterday. For substance, there's a lot that you lose because you need money to sustain. There are people, addicts, who cannot be given money, or they'll demand money but not given money by families, because if you don't give them, they are not sustaining the addiction. So the biggest losses comes in both ways. The addicts themselves, they will lose everything, and they will try to get it back from other people. So you'll find your uncle or your cousin calling you, hey, just send me like 500 bob for lunch and something like that. You clearly know they want. So they'll extort money from you, from your other brother and from your other uncle. So everybody subconsciously is just feeding the addiction without knowing. So the financial impact is not. Once they lose theirs, it's you now who's going to sustain it. So for gamblers, for example, they'll start taking loans. They lost 50K, they'll take a loan of 50. And that 50K, instead of doing something with it, they'll put it in gambling to regain the 50. So it's a really vicious cycle that most people find themselves in. The impact is on both sides generally.
Okay, yeah. I know that one of unapigiwa, I once had a guy who he was a friend at that time, and who used to tell me, oh, you're not very good at these things, kutrade nini, and I believed him. But once you notice, wait, kwani hakuna kitu yukuja, I'm always the one giving and giving and giving, and I realized, hapa ni kama, this guy is kind of addicted, but he doesn't want to admit that, he has a problem. But anyway, with the few minutes that we have, maybe we can. There's another one here, but it's not a question. Marion, one, Anasema, I'm really learning a lot, a recent psychology graduate. Okay. Hata mi Marion, I'm learning a lot. First of all, hapo tuko types za addiction. Hata siku anajua mimi niko nazita tu zote generally ni addiction. But to know behavioral and substances is an interesting one. Yeah, so yeah. If uko na swali, please uliza. We have few minutes to go. But yeah, leo tunaletu foundation. Yeah. But MK, as we're thinking of addiction, unaangalia, unaona, hapa kwa kazi. And I know sometimes someone can reach out for sure and you recommend them. You want the best for this person when it comes to working and being in a, learning environment and all that. So as soon as you just recommend this person, you start hearing stories. Mara mtu alienda akiwa drunk, especially if you're dealing with clients and all that, they will just lose that job. Then they will still come back and ask you again, because you're in a position to. Let's talk about work and addiction. And I've also seen some people who office, you're using the office Wi-Fi, but you're constantly on those apps. Those are betting, you're constantly there. Let's talk about work.
Work is it's very hard to. First of all, there are people who are called functional alcoholics and functional addicts and things like that. These are people who are generally doing very well at their work, paying bills, showing up, doing reports and things like that, but are struggling with addiction behind it. Now, it's not a diagnosis; it's just a word used to describe people who are there. For alcoholics, it's functional alcoholics. Now, the problem with that is that's borderline. It's like social drink. Those people of I just drink over the weekend.
Yeah.
Everyone who is in 90% of people who are in rehab, they started that way. They started drinking on Saturday. They didn't wake up and end up in rehab. So the same thing with everybody who is using the office Wi-Fi for gambling. It all starts as a joke and as something to sustain something, like a small thing. The problem with being a functional addict, functional alcoholic in alcoholism, is you're just one drink away from losing your job. Because now you think that, I can drink, I drink vizuri, I know my level, and then I'll show up to work.
Yeah.
There will be a day when you will lose it and drink 3 instead of 2. And then you'll show up to work.
Yeah.
So people who are working and still struggling with addiction, they're all borderline. Like borderline is one opening of a website away from losing your job or losing everything. One drink away from losing. The problem with that is you don't do it for long. So you can be functional for now. Like you can just be fine. You'll drive back home. People who can drink and drive, even though the government says don't drink and drive, it's fine. The only problem, you can't do it for long. You can work and show up to work drunk or struggling with an addiction or smoking. You just can't do it for a long. So for today, this conversation will not make sense for the person who's a functional addict. But tomorrow, it will make sense because time gives us the space to either return back to normal or one step away from going to rehab. So just like people who start as social drinkers, social drinking is basically I can go to work and I can drink.
Yeah.
But then to rehabilitation centers and all of them tell you tulianza hapo. All of us started there.
Yeah.
So work affected mostly by people who think that they can do work and still struggle and help. So yes, the work will be fine now. Just want to be fine for them. And that's why you see people getting fired for addiction or anything. So you give them a recommendation, hey, go to this company, I have this person. They will show up on day 1, they'll be fine. The problem is by day 5, they won't succeed. So an addict will just struggle all the same.
which is really sad. I think I was listening to a particular podcast the other day, and the guy was explaining how he had a really good job, and he lost it just because, again, he was saying, like you're saying, that just sivi niko sawa, unakunywa usiku, and then by morning I'm okay, I'm good, I'm able to go to work. Sometimes he would sleep in the bar, anaenda kwa gari, change, and then go to work. And he couldn't sustain that kind of a lifestyle, and he ended up losing that job, which was paying him so well that it got to a point now he had to stay with a friend because he couldn't even afford rent. He couldn't even afford basic needs that he could cater for himself. Sasa ilifika mahali he didn't have anything. So it's, yeah, like you're saying, you can't sustain it for long. For now, unaweza jidanganya that niko fiti, and then as you're progressing on, una realize higher, it's getting difficult by the day. And sometimes we think that no one is watching, or people don't realize it. People see, watu wanaonanga hizi vitu, especially in the workspaces, people actually see. Man, time, ni saa mbili. But anyway, I know today was just an introduction, MK. Maybe just your final words on this, your thoughts, because I know as we go on with the weeks, we are going to be talking more on addiction as well. Your final thoughts?
I always say you already know you have a problem. You don't need anybody to tell you that it's a problem. But I always also say that bad habits are not addictions, but bad habits are the ones that turn into addictions. So it's important maybe to check on it becomes a big problem now, because again, go to rehab, they will all tell you, bro, we all started it just started as a small thing, right? So the best is to be able to understand it now, so that everything that I do is I post this to help you make an informed decision. So it's not to tell you this is bad, it's just to tell you can make an informed decision. What you do with this information is up to you. It's not up to me. Mine is just to tell you this. This is the science behind it, and then you choose. So I don't necessarily tell people alcohol is bad, because the government has given you the freedom to drink so long as you're of 18. So why would I tell you it's bad? But I could tell you that this is a percentage of people who are in rehab for the same thing, so that you make informed decisions.
Okay. Hakim Palmer anasema, do you have this meeting every day or same time? Okay, we do have the IG lives the second and the last week of every month, but tumefanya the first week of the first Wednesday of this month, because last week on Wednesday we were not able to go live. So yeah, that is why. But that is when we come live and we have different topics to discuss on. So yeah. So every month kwa mwezi, the second week and the last week is when we do the live. So maybe unaweza tegea for the next one. But yeah, thank you so much, MK, for today. My God, ilikuwa first session, but it was loaded. It had a lot today. Thank you. Make joke kidogo before we go. Unajua venye umesema hapo, mtu anakunywa, yani you do all these things. The lie that is always there ni gari inajua nyumbani. And one day your gari haitajua nyumbani, and you'll end up ati inajua nyumbani.
Those are the lies that are associated with drinking, that I know my limits, mi nakunywanga tu 5. It's a big lie. My car knows it's way back home. Ni tuongo tu zenye zina sustain alcoholism. Because we have no basis, no scientific, no spiritual basis. There's just lies that are associated with drinking. And only an alcoholic, or somebody who's seen alcoholism in their family, will tell you, I know that's a lie. For other people, it might make sense because they've seen people drive akiwa mlevi, but wewe mwenye ni mtoto wako ama ni baba yako, unajua ni uongo, because the way they drive is a crazy way of driving.
Wacha tu. But anyway, thank you so much, MK. I wish Joy was around as well and get to hear more on grace when it comes to addiction, because I know that's her area. She loves speaking about grace and where grace comes in when it comes to addiction in any situation in life. But in case anyone would want to seek help, do you have a contact where they can reach out? Mtu anasikiza tu hivi anasema, I have a cousin, I have an uncle, or hata ni mimi tu, ni mimi. I'm asking for a friend, but it's just me. Do you have any contact?
Oh, yeah, they can just DM us on this page, Good News Mental Space. We'll just try to respond. We're always active on WhatsApp, on call, to just hear you out and see how best we can help. If it's you or someone who's close within your family, we're always open.
Okay, okay. So okay, thank you so much. Today was amazing. I can't wait for us to dig deeper mpaka tufike huko mambo za relapse and recovery and everything. It's gonna be a beautiful ride. Addiction ni wide sana. So yeah, tunaipeleka tu ndogo ndogo tu, but as soon as we are continuing on, we'll be able to be helped. So asante sana MK. Tumalizie hapo.
Sawa sawa. All right. The only problem is I don't know how to end the live. How do I do this?
Oh man, Joy needs to come to the rescue. Wacha nitoke nikuache
Oh yeah, I've
tupambane.
seen it.
You've seen it, eh?
I've seen it.
Aya, sawa. Bye. See you next
Okay.
time. Bye.
Bye.